Hello. I am coming to you today with something a little different. I've decided to make a series of shorter videos about frequently asked questions that I'm getting. So I am right at 3 years post vaginal hysterectomy, as well as pelvic organ prolapse repair surgery. And in that surgery, I had my cystocele, rectocele, vaginal vault prolapse, and stress incontinence repaired. And I also had repair to what they called an absent perineum. Basically, my entire pelvic floor was reconstructed. So I get a lot of questions because people don't have time to watch all 20 of my videos, 25 I think, and honestly, they don't necessarily need to. So one of the questions that I get the most frequently from women is whether or not I had new or lingering urinary issues after having my surgery. And the answer to that is absolutely yes. For me, I needed a stress incontinence repair. So I was having bladder leakage when I would laugh, sneeze, jump, cough, step off of a curb. Some really random things were causing me to leak. But at that time, I only had stress incontinence, no urge incontinence. So I was not getting sudden out of the blue urges where I had to run to the bathroom immediately. But to do my repair in the newest, most recommended way, I needed to have a suprapubic catheter in place after my surgery. My surgeon used a very small piece of trans vaginal mesh tape. So rather than a sling that being placed to hold up my entire bladder, he just used a very, very tiny little piece of tape. Picture Scotch tape, except it's made of a newer, safer grade mesh that's breathable, has some holes in it, and ultimately it is supposed to kind of meld with your own tissue in there. And that is holding up just my urethra. So again, you can do your own research about this, but this truly is the most recommended method for long-term repair and for preventing future complications that old versions of mesh and using large amounts of mesh can cause. So that is what I had done. It's a mid-urethral sling. Sometimes it's called a TVT sling. That's Trans Vaginal Tape. But mid-urethral sling is what I had done. So again, I was sent home with a suprapubic catheter. In the hospital, I had a Foley catheter. So that's the one you're familiar with if you've ever had a baby and gotten an epidural, and they put that actually up into your urethra. I had that as well right after my surgery. I was in the hospital for about 24 hours. But before going home, they took that one out, and I had a suprapubic catheter. So if you look back at my 24 hours post-surgery video, I believe, I actually show that. I kind of panned down there with the phone. I showed what that looked like, but that was literally a tube coming out of the front of my body, out of my skin, right above my pubic hair, between my pubic hair and my belly button. It was coming out of my bladder to help me drain urine for, it's supposed to be a week to 2 weeks is how long most people have it in there, while my body retrained itself to urinate on its own. Your body has to learn to push the urine past that piece of tape. It's while the tape is kind of like melding to your tissue. But your urethra has to retrain itself to push past the pressure of that tape. So for a while, you are trying to go to the bathroom on your own, but you also have that suprapubic catheter that you drain until your body is able to do it mostly on its own. I ended up having to have my suprapubic catheter in place for about 10 days. You can look back at some of my earliest recovery videos in that first week or so and see that that catheter was pretty miserable. It was probably one of the worst parts of my recovery. That being said, I still hold to the research I did and the faith in my surgeon that was absolutely the best way to do it. And I will say I don't have a bit of stress incontinence anymore. Completely gone. I can cough, sneeze, jump on a trampoline, do anything I want. I never sneeze. It has completely revitalized my sick days and my bad allergy days and things like that, where I used to literally just be camped out on my couch because I was going to pee myself if I was up and moving around. Now I can do whatever I want. There are a bit of urinary complications and retraining that has to take place after that type of surgery. And I believe it's probably after just about any type of urinary incontinence surgery, but I will only speak to what I had done. Again, is that TVT sling, that tape under my urethra, which gave me a suprapubic catheter. So even after that suprapubic catheter was removed, my body continued to retrain itself. So it kind of felt as if I had really strong urges to go to the bathroom all the time and not a whole lot was coming out. I would feel like, oh man, I have to go so bad. Like I had been holding it all day or all night, and then I would go sit on the toilet and hardly anything would come out. So it wasn't a very, fulfilling episode of going to the bathroom. That did get better. And then I started noticing at about the 1 month mark that I had some pretty bad urge incontinence. Like just suddenly, maybe I had peed an hour before. My bladder shouldn't have been that full, but I would feel like I have to pee right now. And those urges got really bad when I was near water or when I was kind of sweaty, damp, and moist down there. When I heard water, when I'd be washing dishes, giving my kids a bath, whatever, water was a major source of urge for me. So that was very frustrating and also really scary. I kind of thought like, great, I just traded one issue for another. I mean, which is really worse? Stress incontinence, which I was treating, or this urge incontinence, which is something I didn't have before and I have now. And that was frustrating for a while. I will say now at 3 years post-surgery, it is not really a problem anymore. Now it's only a problem if I truly have been holding my bladder too long. I never attempt to give my kids a bath or do anything where I'm going to be outside and super sweaty or taking a jog or anything like that, where I'm moist, it's hot outside with a full bladder. I just have kind of learned like, I'm not going to let myself get into that position where I'm going to hear water and it's going to make me have to go. And my doctors during my recovery had told me that some of that truly is mental. Like you need to almost train your brain that every time you feel that urge, you don't actually have to go. It's kind of your brain and those nerves playing a trick on you for a while. So at 3 years, it's not really an issue anymore, to be honest. And I would say by about the 1 year mark, I would not have considered it an issue. So again, if I tomorrow needed to make the decision whether to treat my stress incontinence the way that I did with TVT, small little piece of mesh underneath my urethra, have to go through the suprapubic catheter, or recommend it to a friend, I still would. Because for me, the stress incontinence was pretty debilitating in my life. And this urge incontinence, especially now, is just not an issue anymore. The recovery with those symptoms afterwards was frustrating. I spent a lot of time going to the bathroom to not feel a whole lot of relief. I did get a couple of UTIs in that first month of recovery. Again, look at my 1 month recovery video if you want to see some of that and some of my symptoms and some of my frustrations with my medical team in really having to advocate for myself that something wasn't right down there, that it was not just normal recovery symptoms. So if you want to hear more about that, that's in my 1 month recovery video. But I guess I get a lot of questions from women who have had this surgery and are frustrated with the urinary symptoms that they're having, whether it's urge, whether it's pressure, whether it's inability to fully feel like they've drained their bladder, and they're reaching out asking, did I have that? I absolutely did. There were times I would even try leaning to the left and leaning to the right on the toilet to get all of it out of my bladder when I went, but I was told by my surgeon to not be doing that is not good for your bladder, that you need to let it naturally drain. It's okay if some of it stays in, and to try to train my brain to hold it longer, because you don't always have to go when you're feeling that urge. So all of those things, by the 1 year mark, there was drastic improvement, and now at 3 years, like I said, it's not really an issue anymore. So I would still encourage you to go through with that surgery if you're having stress incontinence that is just a major annoyance in your life.